Come on, come on. Come on, Jackie, don't let him beat you. Come on, come on, come on, come on, come on.
Adapting to daily life after a traumatic incident can be very difficult, but through physical therapy, this recovery process can be made easier.
Dr. Catherine Stabile, an orthopedic surgeon, says how she communicates with the physician for the best recovery plan for the patient.
A physician will oftentimes designate a physical therapy rehabilitation program that they would like the physical therapist to follow based on what surgery was performed. But often there's some standard protocols, and those are developed, the physical therapist can develop those based on how the patient's progressing. So it's always geared based on how the patient's doing.
Mr. Tony Degg, a physician's assistant, says how treating an amputee varies from other patients.
It's very similar with any type of injury. It's just that there's a little bit more challenges involved with an amputation.
Lauren, an amputee, looks back on how he lost his arm.
I get caught in what's called a power takeoff shaft. It is a shaft that attaches to a tractor to a piece of equipment to power the piece of equipment. So I got a coat sleeve that caught in the shear bolt, pulled me in, stripped my clothing, and spun me around. Both my legs and my left arm were hitting a concrete floor at about 3 times a second.
The most important part to a speedy recovery is setting a goal for yourself.
You have to have a goal. One of the questions that when the physical therapists ask, when they do the original evaluation on the patient, they ask them, you know, what are your goals? What do you want to get back to doing? Everybody has different goals. I would say the second most difficult patient to deal with is the one who doesn't have any goals. Sometimes it's my job to kind of bring those things to light. You know, what do you want to do?
Recovery time for an injury as severe as losing a limb can be a very long time.
Year and a half, 2 years. I spent 4.5 months in Lancaster General Hospital. I went in April 3rd, '89, and I came out on August 12th. And then I proceeded through therapy for an additional year after that.
Lauren proved all the doctors wrong through his recovery.
They told me I'd never walk because I was paralyzed. So there's goal number one. I was going to walk, and they don't allow you to walk out of a hospital, but I could have walked out of the hospital. The other goal is they told me I'd never regain 100% use of my right arm because I had a lot of damage to that. That's what I mean by they set my goals. Everything you said I couldn't do or wouldn't be able to do, I proved them wrong.
Although the road to recovery may be tough, with enough hard work, it is an achievable goal. For Hempfield Happenings, I'm Andrew Schaffler.